organization is healthcare reform strategy. Now, we have to kind of set the stage here because different rules apply to different size organizations and different types of organizations. So I'm going to take you through a quick kind of a walkthrough on the exchanges because there are some interesting things that are happening there that may or may not affect you, depending on, well, we'll go through that. And then we're going to look at, right now, we're basically mid-year here in 2013. By October, some of the exchanges are going to be up and running, and for enrollment in anticipation of January 1. And so we're going to talk about what admin requirements do you have to take care of as an employer now, right now in 2013, and then what's coming down the pike, can you believe it, less than 6 months away from now. And that will be into 2014. And then we're going to talk about the interaction of the Affordable Care Act and ERISA, and that's going to be probably the red meat of this particular presentation. You definitely want to hear that part. And then we've introduced we've had a pay or play calculator for a long time, but there have been a couple of minor little formula changes that didn't exactly make must-see TV, but they did come out over the last few months. And so we just recently, 2 or 3 weeks ago, issued version 2. And so that's really a great tool because if you're wondering on, gee, should I pay or should I play? Should I offer benefits to my employees or should I pay the fine? It'll help you in all kinds of those areas and give you some very exact numbers. And, of course, we'll take some questions at the very end. All right, so let's talk about status of federal and state exchanges. And I put this on here for a couple of reasons. We have 50 states in the union. There are 33 federal exchanges, 33. That means there are 33 states who basically, for one reason or another, decided not to go through the exercise of either allowing a private exchange in their state or not building one themselves. And the way the law is written and was written back in 2010 is that any state that did not put in an exchange, by default, then the federal government would come in and put in their version of the exchange. Now, there's 33 states. I happen to live in Wisconsin, and we're one of those 33 states. So our governor said, you know, thanks but no thanks. We're not going to take part in that. And so what that means is that we're going to get a federal exchange. Now, if you're in one of the 33 states that has a federal exchange, then there's some things that I need to tell you about. And it's pretty much in this paragraph here, but let me explain it to you. Initially, which you probably all heard, and maybe you know what I'm about to tell you if you've been kind of following the trades on this, it's not the kind of thing that made, again, this stuff is so complicated I don't think reporters know how to talk about it, but I'm going to tell you it square. Any employer that had more than 50 employees, and that's after taking into consideration the deduction of 30 employees. Now, if you go through the pay or play calculator, it's going to do what I'm telling you now. It's going to do all of this stuff automatically. But the federal exchanges applied to any employer with 50 or more employees. There is a line, some language in the law that says the states, the 17 other states, the 17 states who said, thanks, but we'll do it ourselves. We're going to build our own exchange, like California, for example, has built their own exchange. Apparently, they've done a pretty good job at it, from what I've read. The federal law allows a private exchange, if you're in a state that has a private exchange, to basically decide what size of how many employees you have to have the minimum employees be as far as an employer to be able to use the exchange as an employer. But I want to talk to you primarily since 33 is more than half, probably most of you are in states where you have a federal exchange. But I mean, there's people on this call from all over the country. The exchanges, initially for the 33 federal exchanges, was 50 or more. About a year ago, a year and a half ago, something like that. Anyway, it's been some time now. Basically, HHS, on one of those Friday afternoon news dumps when they know it's going to go into the weekend and everybody's going to forget about it, released a rule. They basically threw up their hands and said, we will not be able to execute a federal exchange by the 1st of January 2014, which is what the law required them to do. They said, we can't do it. And then the comeback was, well, when are you going to be able to do it? And they said, they addressed that as well. So if you're in a state that has federal exchange and you have fewer than 100 employees, you will not have an exchange to go to until the earliest sometime in 2015. Now, that doesn't mean January 1 of 2015. It means at the earliest sometime in 2015, which could be 2016. It could be 2017. So in the immediate future, the exchanges which were the particular item, and granted there's a lot of administrative regulation in the ACA, but that was the one thing that really was vexing a lot of employers and thinking, am I going to be paying a fine? Should I put my employees on the exchange? Should I offer this affordable health care plan if I'm not passing the affordable mark right now? I have to pay more. Lots of decisions to make. So if you're under 100 employees and you're in one of the 33 states that's a federal exchange, there is no exchange until sometime at the earliest in 2015. The heat's off on that one. Now, there is a program out there, and it's called the SHOP program, and it stands for State Health Opportunity. There's so many acronyms here. Anyway, the acronym is SHOP. And what it is a type of an exchange. But it's not the kind of exchange that we've been hearing about. It's primarily for real small businesses, and it's part of the law. And those exchanges, if we can call it that, because it's what I'm going to tell you in a second, you're going to go, that doesn't sound like an exchange, and it really isn't. But there will be an opportunity for individuals. You can send your employees. Employees can quit. They're in between jobs. The individual mandate requires that they have health insurance. Everybody has to have health insurance. Maybe it's subsidized by the government. Everybody will have to have health insurance come January 1 of 2014. Now, with the 33 states that are not going to have any exchange for under 100 employees, which, by the way, is where most employees work. They work for a company of less than 100 employees. The SHOP program, what it will be any insurance, health care, any health insurance company that goes on this SHOP website, and that's really what it is. It's basically a website where you can go and enroll on a plan, singular, a plan. You will not have on the SHOP option, you will not have competitive pricing. For example, if you have one of the Blue Cross plans, the Blues plans, and they're called all different names around in the country today, but if you have a Blues plan on there, there'll be one plan on there. That's it, one plan. You may not like it. You may like it. You may not like the price. Maybe you will like the price. The point is you're not going to have any option. If you want to buy it through that and you're under 100 employees, that will be the only option you will have. One plan from one carrier. Humana may be on there. Humana will offer a plan. United Healthcare, largest in the world. United Healthcare will have one plan on there. So when you think about choice and options and comparing pricing and quality measures and all these kinds of things, now that stuff is alive and well as so far in the true federal and state exchanges. But as we've already talked about, there aren't going to be any federal exchanges in 33 states for at least sometime well into 2015 for any employer that has less than 100 employees. The only thing that will be available for employers of under 100 employees is this SHOP program, and that's going to be one carrier, one plan. Doesn't sound too attractive, does it? Well, anyway, that's the update on the exchanges. Now, you might be wondering, well, why is this such a problem? Why couldn't they figure this thing out? Here are a couple of the reasons why the exchanges are running into difficulties. These large insurance companies, and a lot of them run kind of independently in different states because you know how state health insurance works. It's all domiciled by the state. It's regulated by the insurance commissioner of each individual state. So each state is going to have their own set of plans and their own set of regulatory requirements and all of that. And they're all going to have their own technology. And therein lies the problem, my friends. The technology in the insurance business is, not in all cases, but in many cases, archaic, mainframe, old stuff. Now you think about these exchanges that are being built, the federal exchange or these private exchanges that you can go to that are out there. There's software that you can buy. You could build yourself your own exchange if you wanted to. But that's all written in very current computer code. It's the latest and the greatest code. And here's the problem. That new code, these new software products that these exchanges are built on, don't know how to talk to these basically antiquated, ancient systems that these insurance companies. That is a very big problem, as you can imagine. And the other issues are there's so many laws at this point in time in 2013 that have come into play. Just think about protected health information. You've got HIPAA, you've got high tech, you've got genetic under GINA. Those have not really gone away. They've been modified, at least HIPAA has somewhat, and so has high tech, but not to the extent to where it's really easy to start transmitting data, even though HIPAA required that back in 1996, to have these electronic data interchange interfaces. Well, you know, a lot of companies haven't done that. So moving that data around with all the privacy rules surrounding healthcare information, that also is a little bit spooky for some of the insurance companies. So there's an enormous amount of law and legacy law and bureaucracy, and not the least of which is the technology problems that are behind these exchanges that are making them problematic. And we've already seen under 100, they've caved in already. So there's an update on that. Let's go to the next one. Okay, let's talk about some administrative requirements now into 2014. And again, I'm going to set this all up because there might be something you're already thinking about that I'm going to throw water on and say you might want to think twice about that. Number one, individuals who do not have affordable minimum essential coverage. Minimum essential coverage is a phrase. Those are not just arbitrary words. The law requires that you as an employer or as an individual on an individual policy, or somebody who's unemployed and they got to go out and buy it on an exchange at some point in time somehow, that they have to get what's called a minimum essential benefit package. A minimum essential benefit package. That is a defined benefit package. It's not a bad package. It's not the greatest package. But it's okay. It's not bad. But it can't be really less than that. And less than that, it gets into affordability issues. They want a certain level of health care to be offered to Americans. So the term minimum essential coverage is kind of code language for minimum essential benefits. And it has to be affordable. What does affordability mean? It means, as you go down here in the second paragraph here, I'm going to kind of just comment on all this stuff that you're looking at here because I know you already have the PowerPoints. It is unaffordable. Now, the law says Affordable Care Act. Well, if it's unaffordable, it violates the name of the law. Unaffordable care is care that the monthly part of the premium that each employee has to pay, the monthly portion of the premium, cannot exceed 9.5% of household income. A couple questions there. How in the world would an insurance company figure out household income? How would you figure out household income as an employer? We don't have an answer to that yet. Now, the IRS would be able to figure that out, and of course, you know the IRS is a big role here. But that is actually a criterion in terms of affordable. You cannot offer a plan as an employer, nor will there be one available on the exchange, at least not at full cost to the individual, that exceeds 9.5% of the household income of that particular individual. Not the individual's income, household income. The plan on the affordability front must pay at least 60% of its actuarial value of the coverage considered on, well, let me just leave it at that because I can play with that part there. So when you have these plans where it says, well, I'll tell you what, you know, back in the day, you work for an employer and the employer says, we'll pay 80% of the plan, you pay 20% of the premium. And then it went to 70, and then you pay 30, and then kept on keeping going down. Well, there's a floor now. The floor is 60%. So if you are obligated by how many employees you have to offer a plan to your employees or else pay a tax, now you're going to see the word fines in here because I pulled this right out of the regulations. Fines, penalties, forget about it. None of that is fines. None of it is penalties. The Supreme Court said it's all called a tax. So that's what it is. So if you offer a plan that requires the employee to pay more than 40%, because you have to pay 60%. That's the minimum floor of affordability. If you don't, you violate the affordable clause of the Affordable Care Act, and that will cause you a tax. Now, you've probably heard that the IRS is in the process of, at some point in the process of hiring 15,000 agents. 15,000. These 15,000 IRS agents, their sole purpose is not to go out there and see, if you scammed on your accounting or anything like that. They're going after, and there are currently 47 opportunities for tax. They call them penalties, fines, but they're really tax. 47. Those 47 opportunities exist either at the exchange level, but most of them exist at the employer level. So these 15,000 agents, to justify their existence, what their job is. Now, we've never really quite seen this, what I'm about to say. We've never quite seen it to this extent. But we're going to have IRS agents coming around. I'm not trying to scare you, but I mean, this is what the law says. And they're going to be auditing employers' books. They're going to come and knock on your door, just like OSHA can knock on your door today and say, let me see your OSHA logs. Well, they're going to come in and audit your plans. And there's going to be 47 opportunities, not all of which apply to you as an employer. But there'll be plenty of opportunities to find out if you are in compliance with every part of the law. To the extent that you miss any 1, 2, 3, however many areas of these administrative requirements, you will be taxed. Now, for the first time ever, since the wage and price controls of World War II, which is when modern group health care benefits came into play. Yeah, there were some before that, I know that, but that was really when it all happened, when employers were told during the, in 1942 actually, they said, we got a strange economic situation with World War II here, we need lots of bodies here, and we don't have enough people because everybody's overseas fighting, so you can't raise prices. Some of you know that history. But and employers were going, well, what incentive do we then have to bring on employees? Well, the incentive is we're going to give you this new thing called fringe benefits. And that was the beginning of the modern group benefit system that we have today. Now, from that time, 1942, up until today, under all laws, retirement, health and welfare, any laws, cafeteria plans, if you made a mistake, if you violated a non-discrimination rule, yeah, you could be penalized for that, and many people are. Some of the fines are very, very stiff. But as an employer, you could deduct those fines as a business expense under Section 162 on your income taxes. You cannot do that with healthcare reform. First time. Healthcare reform, these taxes, fines, penalties, whatever you want to call them, the Supreme Court says they're all called a tax. If you mess up on the administrative part and you're taxed for that, you cannot deduct that. That is money out the door. It is a sunk cost. Now, what we just got done talking about here, and I purposely didn't go through the pay the fine of $2,000 or $3,000 in this situation. I went through the affordability because I'm going to give you a free download for the pay or play calculator. And there's no point in me trying to address this from a general point of view, and I can actually give you a calculator that'll tell you specifically in your exact organization precisely what your costs, if any, will be. But do note this, that this does apply, these administrative requirements do apply to grandfathered plans. A little bit of history on that. Grandfathered plans were plans that were in effect when the law was signed on March 23rd of 2010. As long as that plan had not changed substantially, I mean, prices could have gone up. That would not be considered a substantial change, and prices did go up. But if you change the plan design, if you change the network, you went to a different PPO or an HMO or something like that, basically that would be a change that would trigger the loss of a grandfathered status. So you see, in today we're looking at the Affordable Care Act, and you see all over the place, applies to grandfathered plans, does not apply to grandfathered plans. The reality is there probably aren't too many grandfathered plans even out there anymore, because in 3 years hence, 3+ years now, the plans have changed. Here's some more administrative requirements. Now here we get into the individual mandate. And it starts off not too tough, but it kind of goes up from there. Let me just read this first sentence for you. Individuals are required to obtain minimum essential coverage. Remember, that's code word for minimum essential benefits. It's a minimum plan design. It's not the greatest and it's not the worst. It's kind of in the middle. And that's what you have to get. All of us have to get that, whether it's through our employer or directly with an insurance company or through an exchange, come 2014. And they have to do that for themselves or, pardon me, and their dependents. So if you're the breadwinner, you're the person who's got the health plan, and your dependents, your spouse, and maybe you have other dependents, you have children, they all have to get that health insurance through you. And they all have to get a minimum health coverage benefit. Now, let's just say that some people say, well, thanks, I'm healthy, everybody's healthy, I don't mind taking risk, I'm not going to get health insurance. What happens then? This is what happens. There will be a tax that will be assessed per individual. In 2014, it'll be $95 a month. Now, if you have a family contract, you've got your spouse and some children, it'll be capped at $285 a month in 2014. Now it jumps. In 2015, it goes from $95 a month per person as an individual, single, to $325. For a family, it's capped at $975, 2015. These are current numbers. They are subject to change. 2016, if you still don't have health insurance, or at that point you decide I don't want health insurance anymore, you will have to pay a tax every month. And the way it's going to work, you won't have to actually fill out a check every month. It'll equal a monthly payment, but you'll pay it times 12 months in a year, and you'll pay it when you file your 1040 taxes. That's where the IRS is going to get the money. That's how they're going to collect it. It's a tax. So in 2016, for a single contract, you'll pay $695 a month, and that'll be capped out at $2,085 per family per month. So now we're starting to get really up there. So this pay or play looks, and people go, yeah, it's kind of on the cheap side, But when you run through the formulas in the calculator, you might be surprised that it's not quite as simple as it seems. The bottom part of this I'm not going to really read because you can do that. It's just a different way of looking at it, that these numbers are all indexed to inflation through 2017. And we don't know what inflation, we know what it is right now. We don't know what it's going to be in the next 5 years, 3 years, 4 years, whatever. We don't know what that is. So that's where I say these numbers are subject to change. Now, in no event will the maximum penalty amount exceed the national average premium for a bronze level exchange plan for families of the same size. There's going to be like a silver plan, a bronze plan, a gold plan, a platinum plan, and each one of these equates to like, kind of a low-end, bare-bones health insurance plan. And then from there, it goes up to, Cadillac plans. And we won't talk about that today, but there's a Cadillac tax for a Cadillac plan, a really high-end plan. But that's what it is, and that's what you'll be able to buy in these exchanges. So you'll not only will you, when they're eventually running, will you have choice between carriers and different plans, but these plans are going to be basically, to make it simple, they're going to be kind of put into 4 categories: bronze, silver, gold, platinum. Minimum essential coverage includes Medicare. So if you have some people that are 65 and they're on Medicare, but they just want to keep on working, the Medicare secondary payer rules do apply, but Medicare benefits do constitute minimum essential benefits, or in this case, minimum essential coverage, same thing. So does Medicaid. Medicaid is going to go through a very rapid transformation here in the next year and a half. It's already started. But the kind of benefits that for people that are perhaps not as well off and they have to get benefits through Medicaid, well, they also are going to be eligible for that same minimum essential benefit plan that everybody else has available to them, even though they don't make as much money. Well, you might say, well, how are they going to pay for that? Well, there's going to be big-time subsidies from the government. The Children's Health Insurance Program, well, that's been around for a while. That constitutes minimum essential benefits, so no change there. TRICARE, which is, I believe that I have an uncle who's a retired career military guy, and he's on TRICARE, so I know that's a military program. I don't know if that applies to people who have not put in their 20 years in the military. I don't know much about that, but if you're in the military, I bet you do know about that. But the TRICARE, which is a military, it's a federal program for our retired military, our great troops. TRICARE, that benefit constitutes minimum essential coverage. Individual insurance plans. Now, there's been a blending between group and individual. It used to be, that was a big gap. For example, COBRA never applied to individual insurance. In some states, they started saying, well, at certain levels, we're going to make kind of like a COBRA-like, because COBRA is actually a federal law, and individual insurance is not governed by federal law. It is now under health care reform. So the lines are really getting blurry on that. But individual insurance policies that individuals may buy, they will not be able to buy an individual insurance plan that does not have minimum essential coverage. And of course, grandfathered plans. The grandfathered plans are going, because they're affected by this, they'll have to be either, if they're better than minimum essential, that's okay. But if they're not as good, they're going to have to be brought up to the standard of a minimum essential coverage plan. And then ultimately, good old group health employer-sponsored plans, the ones that probably everybody on this call is listening about. We're all going to have maybe to adjust our plans. If our plans are kind of bare bones, we're going to have to bring them up to a standard of a minimum essential coverage. Now, for those of you that have Future Office Network, if you go into employee benefit rules, And you'll see that on the left side of your screen when you click on Employee Benefit Rules, there'll be on the left side of your screen, because there's two search engines, but on the left side, don't use the one on the right side, use the one on the left side. That search engine, when you're in Employee Benefit Rules, just simply type in minimum essential benefits, and it'll give you exactly everything you want to know, and then some. It'll tell you really what they are, so in case you're wondering what that really means, and how close does your plan come to that right now, it'll tell you that. Workers' compensation, limited scope dental, vision, not considered minimum health insurance. Why? Well, workers' comp, as we never thought of that as a benefit. It is a benefit, but it's not really sold through employee benefits. Anyway, workers' comp, for whatever reason, is not. Now, dental and vision, limited scope. Basically, what we're talking about here is we've lived through in the last 15 years or so dental and vision being yanked out, carved out of major medical plans, and going into the voluntary realm. So, today, probably, unless you're one of those rare companies that still offers that as part of your health plan, you probably are offered dental, if you're offered it at all, dental or vision as a voluntary employee pay-all benefit. And so, just because it's kind of a different duck, the law exempts dental and vision from having to provide any kind of a minimum essential benefit. It's not part of the equation as far as healthcare is concerned under the Affordable Care Act. Okay, a few more things. Pre-X, I think you all know about that. HIPAA was supposed to make it a lot easier and avoid job lock back in 1996, but never quite made the mark. It was complicated, those certificates of creditable coverage, the 63-day window, all of that stuff. Well, right now and for the last couple of years, anybody under age 19, you could not apply pre-existing condition exclusions to those under 19. Probably everybody would like this one, especially if you've got a chronic health condition. But come January 1 of 2014, no more pre-existing conditions, period. Nowhere, no how. There's no pre-X. No pre-X for anybody of any age in the United States. That also applies to grandfathered plans. So if you have a grandfathered plan that does have pre-X in it, well, come January 1 of 2014, that's going by the wayside. Group health plans and health insurance issuers cannot impose waiting periods of more than 90 days. Now you might wonder, like, gee, why do they do that? 90 days? 90 days. I mean, that's a long time. I mean, we're trying to recruit and retain qualified employees. I mean, heck, they're balking at 30 days. They want health care on the first day that they get hired. 90 days? Well, the reason they put that in there is because I'm going to say something that's going to be, some of you are going to disagree with me when I say this, but I am telling you the truth. ERISA applies to all employee benefit plans. ERISA applies to all employee benefit plans. Bear with me, don't start howling. Now, then there's some exceptions. For example, if you have a payroll practice, like a short-term disability. A lot of companies, because you can calculate the exact dollar of the maximum risk with the short-term disability plan. So why should you insure that and pay the insurance company? And I know a lot of companies do this, but I could never quite understand that. Because if you're paying more than if you just continue the salary at 66 2/3% on SPD for 26 weeks, even if you have to pay the full 26 weeks, you know exactly what your risk is to the penny. Now, if you give that to the insurance company, they're going to know that too, but they're going to want to make a profit on that. So most employers, not most, I shouldn't say that, many employers pay short-term disability out of the general assets of the employer. So short-term disability is not an ERISA plan. Certain other disability plans are not. Now, our point here is not to talk about what is not an ERISA plan. Our point here is to say that all health insurance plans are ERISA plans. Now, Section 125 plans, cafeteria plans, are for purposes of ERISA and for purposes of the tax code, health insurance plans, or health plans. ERISA applies to all health plans. Now, some of you are thinking, wait a minute. In my state, we've got Humana, or we've got Blue Cross, or we've got XYZ, and the state insurance commissioner of our state regulates and makes a determination if the insurance company that wants to sell in our state can even sell a policy. And then they're going to have to propose the policy. And the insurance commissioner and their folks are going to check it out and approve or disapprove or modify what the insurance company can sell in our state. And then they're going to have all kinds of other powers that they can do. Well, that's all true. ERISA preempts state insurance law. So how do we reconcile those two? Because we know that both of those are true statements. Yes, it's true that the state insurance commissioner can regulate insurance in that state, regulate it. But ERISA also says that it applies to all employee benefit plans. And specifically, healthcare plans are included in there. Here's what that means. Here's the secret of that. The administrative portion of health plans, whether they be insured or self-funded. A lot of people say, well, ERISA means it's self-funded. Well, that's true, but it also means that it applies to insured plans. Now, I know some of you have been taught just the opposite a million times, but I'm telling you the truth. ERISA applies to insured and self-funded health plans from an administrative point of view. For example, if somebody goes out, and if you have an insured plan or you have a, well, let's just talk about that because probably most of you, that's what you have. But it works equally with self-funded plans. If somebody goes out and really mismanages the plan at the employer, let's just say that they take the salary deduction from the employees. They take the money. And what they do, instead of giving it to the insurance company, somehow they're absent-minded or whatever, something happens, and they do not get that money to the insurance company. And the insurance company calls and says, hey, we didn't get any money. We're terming all of your employees as far as dropping them off the plan because no money, no insurance. Well, that's going to be quite a problem. Now, somebody's accountable for that, and that happens to be a fiduciary responsibility. It's a fiduciary duty. Fiduciary responsibility is an administrative requirement, and it's codified in ERISA. So, I think we've beat that one to a pulp. Suffice it to say, ERISA applies to insured and self-funded plans, and since most of you probably have insured plans, please know that from an administrative point of view, ERISA does apply. Now, that also means this, and this is probably something a lot of you might not be doing. I hope you're doing it, but my experience is a lot of employers don't. You have to have a plan document. If you have an insured plan, let's just pick a number. You're 40 employees. Yeah, you have to have a plan document, Title I of ERISA. Number 2, you have to have a summary plan description. 40 employees. A lot of people think, no, that all went away. It's over 100 employees you got to do that. No, the only thing that's over 100 employees is filing the 5500. The stuff that you disclose to the employees, you need an SPD. If you change the plan, you have to issue a summary of material modifications. All that Title I stuff applies. And I tell you, there aren't many employers that are doing that, but that is the law. Now, I'm not saying this to scare you. I'm not saying this because I see your name and I'm going to turn you in. None of that's going to happen. I'm your friend. I'm not here to do that. I am setting you up to tell you something here in a couple slides that is going to make all of this stuff crystal clear. Under ERISA, 90 days. Under ERISA, you could make a person sit out for a whole year. But we've never seen that, right? Because who in the world would be that dumb to offer a health plan and say, hey, employee, come on and work for us. You got a health plan? Yeah, that's the most important benefit that people look for. Well, when can I get on it? Well, you got to sit out a whole year. It's not going to sell very well. Well, so this is basically addressing really the only previous requirement that's been out there in terms of the length of the waiting period on a health plan, which is ERISA. And that's 1 year. So now they're saying that goes away. We're overriding ERISA, and now the maximum is 90 days. Hopefully that makes some sense now. Group health plans, including grandfathered plans, cannot impose cost-sharing amounts. For example, copays, deductibles that are more than the maximum allowed for high-deductible health plans. Now, these are HRA or HSAs coupled with a high-deductible health plan. So if you don't have an HRA and you don't have an HSA, you have just some other kind of a health plan, you cannot have a deductible that exceeds whatever that current year's single or family deductible is for a high deductible health plan. That's what that's saying. Now those numbers go up every year because of inflation, and that's going to continue to go up, and unfortunately we're really getting whacked with some pretty bad inflation nationally. In certain states it's not true, but nationally it's pretty high right now. Health inflation. Group health plans, including grandfathered plans, may no longer include more than restricted annual or any lifetime dollar limits on essential health benefits for participants. So annual limits, yeah, you can put some on some benefits. You can do that. We're not going to get that deep in the weeds on this one for this Smartcast. But another important thing here is lifetime limits. You remember that, it used to be like it was $1 million, and then it was $2 million, and then it became $3 million. I saw something the other day where nationally the average family contract, $22,000 for a medium grade group health plan contract, $22,000. It's a lot of money. So we have to start moving these lifetime limits up. Well, if somebody stays with a company for 40, 45 years, which admittedly is extremely rare today, you could blow through that. If you're really sickly, you have a premature baby, you have a lot of health problems, you have cancer. It's amazing how you can run up a big tab. But anyway, lifetime dollar limits gone in 2014. The maximum premium discount that an employer can offer under its health plan for participation in a wellness. ACA is all over wellness programs. Now, in 2001, there was something published called the Bona Fide Wellness Regulations. And wellness really took off after 2001 because it was the first time that we had legal guidance that said, if you do this, if you offer your employees this kind of a wellness program, whether or not they pass it or not, but if they just sign up for it, you then can give them an incentive that's going to lower their health care costs, the premium that they pay every month for their health care. Well, what's not to like about that? But the top end of that was 20%. It was 10, 15, and 20%. That has now gone up, effective January 1 of 2014, to 30%. So, wellness program, we all know that, gee, if we can stop people from smoking, if we can reduce body mass index, if we can, improve people's diet, all these things that wellness programs do, we're going to be healthier people, our healthcare costs should go down. And by the way, we're also putting in an extra kicker here of an extra 10% from 20 to 30% to give you an incentive to put in a wellness program and get people to say, hey, join the wellness program, because just by joining it, we will reduce your health care premium. The U.S. Supreme Court effectively ruled that when they ruled on the individual mandate being a tax, that Congress had the power to tax on June 27th of 2012, almost 2 years ago. 2011, beg your pardon, 2 years ago. There was a part of the clause, because the individual mandators have made the headline news, but there was other stuff in that ruling, and this is important. The Supreme Court in that same ruling made the requirement for states to offer Medicaid benefits. Now, Medicaid is administered by the states, but it's federal money. And they said that the states are going to have to. It is not optional. They're going to have to offer Medicaid benefits, here we go, to all persons with incomes at or below 133% of the federal poverty level, And that number changes obviously every year. Now it's optional for each state as to how they want to handle that. But suffice it to say that we're going to see people that are perhaps maybe not as well off, or they're in a tough time financially in their life. They're going to have much better and much greater access to Medicaid benefits, provided that their household income, adjusted gross income is actually the correct term. Adjusted gross income is at or below 133% of the federal poverty level. So I don't know how you feel about that, but as far as the people that really may need it a lot, that's probably a nice thing. Now, there's no free lunch. This is all going to be wrapped up into a health insurance premium. All right, this is the slide that I think I really want to talk with you about and have you guys understand, because it's something that I found that a lot of people don't understand. Some of you know that I write a column in a magazine called Employee Benefit Advisor. If you go out if you just go on the internet and just type in www.employeebenefitadvisor with an E, advisor with an E, employeebenefitadvisor.com. You'll bring it up, and you can find me in there under healthcare reform, under advisor strategies. Anyway, this is all stuff taken out of the regulations, but this is actually my writing. Now, this is the part that please pay attention to this. If you heard nothing else in this Smartcast, please hear this part because it's so important. ERISA was about 40 years in the making. And the reason it took so long is because it was primarily a pension plan law. Healthcare was it was really nothing back in the late 60s when this was being developed. Healthcare, that's nothing now. Little did they know that sometime down the road, it was going to become a big deal. But ERISA does apply to health insurance. It also applies to retirement plans. But some of the provisions apply to both. Now, since 1974, I would ask you, just rhetorically, can you think of any law that has the gravity of the size and complexity and the opportunity for misunderstanding on the part of advisors and employers like the Affordable Care Act? I can't, and I've been in this business for a long time. The closest one that comes to that is the Tax Reform Act of 1986. And that was a cakewalk compared to this one. This is tough stuff to understand. 2,700 pages, 15,000 pages of regulations and growing? How in the world can you follow every single piece of that? Now, that being the case, a lot of employers, because of this pay-or-play concept, are entertaining a strategy to get their number of employees under 30 employees. I know you all probably have heard this or read this, or maybe you're thinking about this. I want you to think twice about it. Now, if you can get your full-time employees, actually full-time equivalents, under 30 employees, what happens is, and you really want to get them down again, this pay-or-play calculator is going to walk you through all of this. It'll tell you all of this stuff. You just got to punch in the numbers. It's really great. But what it'll do is you really want to shoot to have your employees at 28 hours. Because when you're at 29, there's some rounding things that can happen that could bring you up to 30, and usually insured plans have eligibility requirements. Not always. I know some of them are a lot less than that, and some of them, not too many of them are higher than that, but that seems to be the common number. And the idea is that, just follow me, some employers are thinking, hey, if I can get my full-time equivalent employees under 30, I will be dropped off this requirement that I have to offer health insurance as an employer, which is true. So I'm going to get them under 30. So they look around, and they say Susie. And Susie's working 33 hours. Or maybe Bill is working 35 hours. Mary's working 32 hours. John is working 36 hours. And maybe that employer looks at those 4 people and says, we're paying them, I think we could probably do just as good of a job as an employer if we cut their hours. So the employer starts thinking about this. And maybe somebody's in there whispering in their ear and saying, hey, take the path of least resistance. Get your employee count down under 30 hours and you won't have to worry about any of this stuff. You know what? That employer, especially if they've done the pay or play calculator and they go, oh man, my responsibility financially is going to be absolutely enormous. And in some cases that is true. It's pretty hard not to look at that. Now, you can cut the hours as an employer of any employee. You can fire any employee as long as they don't have a contract. You can discriminate against an employee as long as you're not violating any lawful discrimination. For example, if somebody's got blue hair and you don't like blue hair, it sounds pretty crazy, but you can say, hey, listen, I don't like blue hair. You're fired. Does that employee have any recourse? No, they really don't, because you have not violated any discrimination law by saying, I don't like people with blue hair. You can just say, I don't like the way you look, and I'm really in a crummy mood today, and you're fired. Well, it's going to have some other repercussions, but you're not going to get a lawsuit over that because you haven't done anything legally wrong. Now, let's get back to cutting people's hours under 30. Let me read you something here. Section 502 of ERISA. This is kind of like I call it the backwaters of ERISA because there hasn't been any law that has really massively tested this particular section. But you know what? It's still there. It's never gone away. And here's what it says. The poignant part of ERISA Section 10 states this. This is exactly out of ERISA, my friends. That's why it's in quotes. So you can interpret this however you want. It's pretty straightforward. It shall be unlawful for any person to discharge, fine, suspend, expel, discipline, discriminate against a participant, they're talking about a plan participant there, or a beneficiary for exercising any right to which he is entitled. Sorry, ladies, they wrote things kind of on PC back in those days. You can't do anything bad to somebody who is exercising any right to which he is entitled under the provisions of an employee benefit plan. It doesn't even specify what kind of plan. It applies to all plans. It applies to health plans. Or for the purpose, what's the purpose of your interference? What's the purpose of your discrimination? What's the purpose of your disciplining, suspending, firing? If the purpose is interfering with the attainment of, here's that word again, any right to which such participant may be entitled under the plan. Let me summarize that in a very conservative way. It's illegal for any employer that has an ERISA plan. All health plans are ERISA plans. Let's just lay that to rest. So if you have a health plan and you cut somebody's hours to drop them off the eligibility list, there are two things that are going to happen. One, is that employee going to be happy or sad that you've dropped them off their health insurance? They're probably not going to be too friendly about that. Number two, you've cut their hours. That means they're making less pay. So now they're making less money and they've lost their health insurance. Are they going to be happy? No. Is there a chance that they're going to come in and talk to you or whoever's in charge of the health plan and maybe have a kind of a heated discussion? At least it'll turn into that. Probability pretty high. Wouldn't you agree? What about the manager who's taken all this heat from these employees? It might be one, it might be a handful, whatever. That manager probably doesn't know what I just read there. Section 510 of ERISA, that they cannot interfere with, it's a right. You know what civil rights are? Of course we do. Rights, that's a big word in federal government, rights. They have a right to participate in their plan without interference. Now the manager who's sitting there taking all this heat about, you cut my hours, you cut my benefits, this place really has turned into a crummy place, la-di-da-di-da, and then it turns into a hurricane, it gets all heated up. And what is the chance that maybe that employee gets discharged, fined, well, fine, I don't know how that would work, but suspended, expelled, disciplined, maybe they get demoted, you know, maybe they got put on some really crazy work, you got to work weekends for the rest of your life, or maybe they get fired. I've had enough of you. All you do is complain. I've had enough of this kind of stuff here. We have a right to run our business the way we want to do it. Yeah, that's true. And so, you don't like this? Lump it. You're fired. Get the heck out of here. Okay. Well, that employer has, here's what's happened there. The single motive, now maybe it's not going to be in all cases, but the way I've just explained that is what I hear lots of employers considering. And you know what? Come on. The single motive there was to get them off the health plan to avoid the purposes and the taxes of the Affordable Care Act. It's a subterfuge. That's illegal. Section 510, that's what that's in there for. It says you can't do that if that's your only motive. If you have other motives, but you better be able to really prove it. But, you know, it sounds like, it walks like a duck, looks like a duck, it's a duck. You know, if it looks like the only reason you're doing this is to get them off the plan to save your bacon on the Affordable Care Act, your motive is singular, and it's against the law under 5010. Now, this person gets, they've interfered because they've already been, you know, arguing with the employee. That is interference. If they fire the person, if they discharge the person, if you put them on probation, if they put them on some weird hours, whatever they do, that's called retaliation. That's violation number 2. And that's found in Section 502. I did put it in here because I'm explaining it to you. So there are 2 potential violations, both of which can result in a civil penalty and fines that the Department of Labor from the United States government can come and visit you and say, here's a tax that we will impose upon you with our buddies at the IRS, and you're going to have to pay for that. That's a nasty thing. So the question, be careful about, know that the employees have 510 and 502 rights. Number 2, watch out for a single motive of cutting hours and cutting people off the plan. Very dangerous. The bottom line is that you or your employer client, in this case you as an employer, you're going to be on shaky grounds with a cut in hours strategy unless it is coupled with something that is legitimate business necessity. But you know what? If you get called on the carpet on that, the lawyers are out there outside the door. They know that this is red meat. They know that if they can find that, they're going to whip out 510 of ERISA, and they're going to have a 510 claim. And that's not going to be a pleasant day for you. Penalties always get attention. So it's a civil action, and it's DOL violations against the fiduciary. A fiduciary is the person who manages the plan or who manages the person who manages the plan, because that person then, the boss of the person running the plan, has discretionary management of the plan. That's a fiduciary under ERISA. And those people personally can be assessed a fine. Now, generally, there's fiduciary liability insurance, but I don't know of anybody who has fiduciary liability insurance for a health plan. Pension plans, absolutely. You'd be crazy not to do that, but not for a health plan. So you've got a huge potential liability on this slide, and that's really what this slide is all about. I'm going to take some questions, but before I do that, I do want to show you this really quick here. This will take 2 seconds. Okay. If you just go on, I'm not trying to promote anything. I'm not trying to sell you anything. I'm really not. This is where it is. If you go, and it's in FON too, but it's easier to find it right here. Just go to davidsonmarketing.com. davidsonmarketing.com. Write that down. davidsonmarketing.com. When you go on there, go under Services. Click on FONHR. Click on it. davidsonmarketing.com, Services, FONHR. You'll get this page. You can download it right here. It's free. It's fantastic. It's accurate to the penny. It's just wonderful. It's wonderful stuff. So I encourage you to do that. So with that, I'll take any questions that you may have. Let me see if anybody has any hands up. I do see one hand here. Cindy, let me just Cindy, I'm sorry, but I know you have a question, but you didn't enter in your PIN number, and so therefore your phone won't work. So if you're given a PIN number, or you can see it down there below that, if you just type it in right now, it'll allow me to call on you. Otherwise, you're going to have to type in the question down there towards the bottom. The other hands up here. Okay, let me see if we have any questions in here. We got a few. Okay, the audio keeps cutting in and out. I'm sorry. I try to talk as close to the microphone as I possibly can, but sometimes I've heard that before, and it's kind of vexing because I don't know what the problem is. But I am sorry about that. We talked about TRICARE. TRICARE is for current military and their dependents, too. Thank you very much, Cindy, for pointing that out. Thank you. I was not clear on that. So TRICARE, it is a military plan. It's for current military and their dependents. It obviously is for retired military, too, because I know my uncle's retired Army, and he gets TRICARE. Where do we find the list of what constitutes minimum essential benefits? Well, where do you find that? You find that if you go into Future Office Network. Go into Future Office Network, and on the very top, when you first open it up, you'll see across the top the 5 disciplines. The first one is Employee Benefit Rules. Click on Employee Benefit Rules. Then on the left side, you'll see a search engine will appear, and type in minimum essential benefits. That's it. And then click on search, and it'll bring them up. It is just that simple. It is that easy. We have got everything you could possibly think you'd ever want to know on healthcare reform. Okay, one more pass at people that maybe raised their hand. Let me see if we have that there. Becky, okay, thanks for putting in your PIN number. Do you have a comment or a question?
Are we able to print the presentation?
Yes, you certainly can. Are you a subscriber for Future Office Network?
Yes, we are.
Okay. Well, all you got to do is log on there, and you'll see that it's right in the latest documents. In fact, you probably should have received it as a communique yesterday, probably yesterday morning. But if you didn't get it, then somebody just didn't send it to you, whoever your agent would be, and I would just give them a call. But
Okay.
You can just go on latest documents, and you'll see them right there. And if that doesn't work for you, go up at the top and you'll see Smartcast. Click on that. Click on PowerPoints, and you'll see it's the very top one.
Okay. Thank you very much.
Thank you, Becky. Okay, and I don't see any more questions, so please fill out the evaluation, everybody. Thank you for your time. Hopefully we covered some really good stuff and gave you some food for thought. Have a good day, everybody. And